Welcome, Westminster Manor residents. I'm Jeanette, your resident council president. I'm here today with our executive director, Tracey. We came in with our masks and we're in the craft room, and we're here because our resident council had a meeting using our conference call feature on April 15th. And during that meeting on April 15th, a number of questions were raised by our resident council representatives. So we're here today. I'm actually going to ask Tracey some of the questions that were raised by the representatives that day. So thank you, Tracey.
I'm super happy to be here, and I really want to take a moment to thank the residents for all of your cards and your support. I know this hasn't been easy, but we are really, really thankful for all of your support during this time.
Tracey, there's a lot of talk about testing in the media these days. Can we get tested?
Well, a test is a snapshot in time. So we're not going to, at this point, test everyone. Simply because you may be negative today and 2 days later you may be positive. Testing can be very dangerous if you let your guard down. Sometimes when people are tested, they say they're negative and they no longer worry, and we don't use the precautions. Sometimes when you're tested, you might have a viral load and it not be enough of the disease to test positive, and that's why you may test positive later. And meanwhile, thinking you're negative, you may spread it. I think it's important to know that what we're doing is working. With everybody staying in their homes and trying their best to limit their going to any outside sources, and that has kept us safe. But if you should start to show symptoms, or if you've had contact with anybody who is positive, then yes, please see your doctor and let us know immediately.
Thank you. Some of our residents are confused about the role of Paula Doherty here on our campus. Can you clarify what Paula can do for us and what she can't do for us?
Certainly. So Paula is our health resource nurse. She coordinates care. So the first thing she does is she assesses residents to make sure they're in the appropriate level of care. Secondly, she coordinates care for the independent residents, whether it be lab work or physicians in the office or home care if you should need it. Thirdly, she promotes and provides education to the residents with monthly seminars or however is appropriate one-on-one teaching. And lastly, she works with our team here to respond to emergencies.
Thank you. So who do we call if we get sick in the middle of the night?
So as an independent resident, you can certainly press your button or ring your bell and we will respond. And we will stay with you until 911 can come. We don't provide medical services at the bedside. We are not licensed to provide medical services, but we will be there and assist you in getting the care that you need.
So if we do go to a doctor's appointment, do we need to then self-isolate for 14 days after we come back?
No, a doctor's appointment is considered essential. What we want to caution everybody is that you're really putting yourself at risk when you go to the doctor's appointment. Because of that, I would strongly advise that you call your doctor. Many of the doctors are doing video chats just as we're coming to you. They can come to you through your phone or through your iPad, and they can speak with you and do the doctor's appointment that way. If you have questions, call the doctor's office, or Paula might even be able to help. Secondly, if you have to go to the doctor's office, be sure and call ahead and see if you can go directly from your car to the exam room and not have to wait into the waiting room. And then use all the precautions. Come home, change your clothes, wash your mask, etc.
Thank you. We are concerned about the staff and the people that are working in our health center. Do they have enough protective equipment at this point?
Absolutely. In the beginning, when the pandemic started, we definitely was struggling to get what we needed. There was definitely a shortage, and we were paying very high prices. Since then, there has been a mass production, and we do have what we need. We do not have any active cases, so we don't need as much, but we have been able to develop a little bit of a stockpile in case that would happen. We would be prepared. So we have everything we need, and I really want to thank so much of the residents here in this community and throughout the Bradenton community, because we have had probably, my guess is 800 masks donated to us.
Oh,
So we have been able to thoroughly give everybody a mask in the health center, and we can wash them frequently to make sure that, so that has really
Right.
helped us with the PPE.
well, that's really good news to hear, and I think there's a lot more that we could learn about the health center, but we'll probably save that for another time and sit down and really go into more detail on how residents are being cared for, because we can't visit, so we really don't know what's going on over there. How much longer will we have to stay in isolation if the governor moves to start to open up businesses in the state?
So if the governor starts to open up businesses, our MSS, which is our Management Support Services, will look at everything very close. They'll look at what the governor says, what the CDC says, what the Department of Health says, and they'll weigh all of those options very carefully. We are aware that the self-isolation is definitely a difficult process for all of us. But we also know that what we've done up to this point has indeed kept everybody safe. We are very fortunate that here at Westminster Manor we have not had any cases, and so we are a bit conservative, but we definitely look at all sides to make a well-informed decision to keep you safe, our employees safe, so that we hopefully can keep this virus out of our community.
Right, and I know that you, and fortunately we resident council representatives are also invited into regular conference calls with the MSS staff in Orlando, so we are being kept up to date on a regular basis as to what's going on, and we really greatly appreciate the effort that they are going to keep us informed. And I would say that in general, there is a great appreciation in the Westminster Manor community for all that the staff here is doing for us and all the MSS staff did in looking ahead and early on catching on to how difficult this pandemic would be. One way I plan to say thank you is that in the stimulus check I received, I plan to donate some extra money to the resident employee Christmas fund, because I know that that's one way that every single employee will get at least a small portion of the thank you that I want to give them. And there's absolutely no way that I could possibly know each one of them and what they've done to create and contribute to our health and safety. So I just plant that little seed with you in case that's something you might want to think about for yourself. Our resident council will have another conference call on May 6th, Wednesday, May 6th, and I invite you to pass your questions on to your representative to the resident council from your area, from your floor, or to the area you live in. We will all be together on May 6th on a conference call, and once more you'll have a chance to bring your questions forward, and following that we may have another opportunity to sit down with Tracey and ask some more questions. So I say to you today, Manor residents, stay Manor strong. And now we'll put our masks back on and prepare to go out into the public. Thank you, Tracey.
Thank you.